Hi, hello, how are ya? I'm back. It's January. Are you guys excited? It's the start of the new year. Dr. Faith here. I'm your Faithful Doc. Today we're going to talk about something you may or may not know much about, but we're going to talk about it anyway. Today we're going to talk about the thyroid. I thought that I would go over the awareness months as a part of my channel so that you can, become aware. I'm Dr. Faith, I'm your Faithful Doc, and today we're going to talk about Thyroid Awareness Month. So January is the month of thyroid. Why is there a whole month for thyroid awareness? That's a really good question because did you know what a thyroid was? And that's why there's a whole month for it. Some of you might know what a thyroid is, but you don't really know what it does, which is fair. It does a lot of things. Basically, it's your furnace for your body. So it lights everything on fire. Nah, I'm just kidding. But it does do a lot of things, and that's why people are so affected by it. Naturopathic doctors are known for doing preventative medicine. And what's more preventative than making you feel better about yourself? We deal with a lot of thyroid hormones, as you can imagine. So let's talk about some facts, shall we? So what is a thyroid? Great question. It's a little gland that sits right about here and it's butterfly shaped. Weighs about 20 grams. I'll put the calculation right about here in terms of metric versus US based measurements. Basically what it does is it tells your body to turn things on. Who is affected by thyroid problems? 60% of Americans don't even know that they even have thyroid issues. That's a lot of people. It goes misdiagnosed often because it has the most random symptoms. I mean, you get like constipation, fatigue, brain fog, your hair is quite thin, your nails are really brittle, you just don't feel like yourself. So who is affected by thyroid problems? Mostly women. They outrank men 5 to 8 times the amount. And they say that women over 35 have 30% more chance of getting more thyroid issues. I'm 31. So make sure you check it out. What does it do? It has 2 different hormones that it pumps out. T3, T4. T3 is your active, T4 is your inactive. We need lots of T4 around so we can convert it to T3 when it's needed. What happens is that the thyroid sometimes can't keep up with its demands, or it has autoimmune issues, which means it attacks itself. So therefore you have too much or too little thyroid, and then you have all kinds of problems. So let's talk about some common myths that you might have heard of when it comes to thyroid problems. Number 1, you would know it if you have a thyroid problem. Like I mentioned before, 60% of Americans don't even know they have thyroid issues. And you know what? Sometimes you might have subclinical issues, which means you feel a little bad, but you just don't know why. Myth number 2, only older women get thyroid problems. That can't happen to me. I'm 20 something. Nah, brah, it happens to everybody. It even happens to men. Not very often, but it does happen. So it's not just old people. Your environment, your genetics, sometimes your lifestyle can just tip you over into that autoimmune problem. You might have a problem that you don't even know about, and then you eat a bunch of crap and you eat a bunch of processed food for college, and then all of a sudden you got thyroid issues and you don't know what happened. So it's not just old people, it definitely can be you too. Number 3, taking iodine supplements can help your thyroid problem. Now here's the thing, this is not completely wrong. There are different issues with thyroid problems. You need iodine for thyroid hormones to be made, but basically if you have an issue with not having enough iodine in your diet, then yes, it can help you. But if you have Hashimoto's, there's not enough iodine in the world that can help you with your issue. You need thyroid hormone. And bonus problem, if you take too much iodine, you can actually make the problem worse and then make your thyroid have an issue because then you have too much iodine in your system, which can trigger thyroid problems. So this myth actually makes me chuckle because it doesn't make any physiological sense. Doing headstands in yoga can actually help your thyroid work more efficiently. I mean, if you do headstands, yes, blood flow will go to the thyroid area, but that is just not how hormones work. You have more blood going to the area, it'll cycle what you have going on around your body, but it's definitely not going to make you produce more thyroid hormone. I don't know if this was a guru that just decided to start making this myth up. It just makes me laugh. Do headstands, it's great. Helps you de-stress, which is lovely.
Lack of stress helps your thyroid.
But doing headstands isn't gonna make you produce any more T3 or T4. So, Understand that. Myth number 5, if you have a lump in your throat, you have some kind of thyroid problem, whether it be cancer or something other crazy thing happening. No, that's actually a myth, because the fact is that we have something called goiters. What that is basically it's a lump that happens in the throat, and it could be benign and it could be a problem. The most important thing is to get checked out by your doctor. Listen to me. Listen. If you have a lump in your throat, get checked out by a doctor, because it could be nothing or it could be something. Either way, go see somebody about that. Myth number 6, if you are gaining weight, you have a thyroid problem. It could be true, it could be false. You never know. Go see a doctor. You could just be, I don't know, eating a lot of cookies, like I had in this video where I talked about how to avoid gaining weight in the holiday season. It could be stress. It could be a multitude of things. One of the first things I do when I see a patient is I make sure to check their thyroid, because you can't chase a thyroid problem with enough diet and exercise. So why not make sure that's out of the way before you do anything? Myth number 7, eating any soy products will affect all of your thyroid. Soy products do affect your thyroid. I'm not going to sit here and tell you that it doesn't. So when you have an issue with your thyroid, make sure that you limit your soy intake. If you have a thyroid problem, I do have something to say. Make sure you're taking your medications in the morning, because that's when thyroids are most active and it needs the most help, away from food. But it is okay to eat soy products a couple times a week and at night if you want it to function the best. Another thing to note is when you eat soy products, make sure that you're eating organic, non-GMO soy. I know, it's expensive. That's another myth. It ain't expensive. It's like $1 more. If you subscribe to that eating habits in which you don't want to eat meat, that's fine. Eat soy that doesn't affect your body as much as GMO, non-organic soy does. It's so cheap, I can't even. So let's talk about the 3 different types of thyroid problems that you can have. Number 1, it could be overactive. It's just going everywhere. It's just pumping out thyroid hormone all over the place. In the overactive category, we have something called Graves' disease. When you have way too much energy, you sweat easily, you're like going a million miles an hour, and then you get all of that jitteriness, and you can't sleep, and you keep losing weight, and you have diarrhea. Nobody likes diarrhea, you know what I'm saying? Graves is not a very common condition, so a lot of people don't have to worry about that. Then there's the downer kind of people. Those people have hypothyroid. They're tired all the time. Their hair is falling out. Their skin is dry. They can't lose weight. They can't remember anything, and they're cold all the time. In the underactive category, we have something called Hashimoto's, which is an autoimmune condition. Basically, your thyroid is attacking itself, and therefore you're not making enough active thyroid to be able to be pumped around your body. And there's also cancer, which, if you're going to get a type of cancer, it's not the worst one to get. That would be the one I would want to get. Not that I would want to get cancer, not that I want anybody to get cancer. I'm just saying, if you're that unlucky person, maybe that's the one you want to get. It's pretty easily treatable. A lot of times they just either remove the thyroid or a nodule, or they can easily treat it with chemotherapies, and then you go on with your merry life. Let's talk about the treatments for thyroid problems, shall we? If you have an actual thyroid issue, it is good to get a treatment, because no one likes to feel like that, as well as it's really important to have your body functioning optimally. As naturopathic doctors, we believe in preventative medicine, but when you got a problem, you gotta treat it with medications. So let's talk about the medications that we can do to try to help these people. There are 2 different kinds of thyroid medications. There's synthetic, made in a lab, and there's bioidentical. Why does this matter? I personally subscribe to the fact that bioidenticals are actually easierly absorbed. That's my personal opinion, because I think the body has a better chance of using things that are more natural than they would using synthetics. But let's use the analogy of something like cheese, shall we?
Cheese, glorious cheese.
There's American cheese, and then there is Wisconsin cheddar. Now, think about that cheese pull. With the American cheese, does it happen? Yeah, it does, and it's delicious in a grilled cheese, but everybody knows it's synthetic. Everybody knows it's made in a lab. It's plastic. Have you looked at the ingredients of American cheese? Synthroid, levothyroxine, all of those medications, they're not particularly bad. I wouldn't say they don't get the job done. For some people, they're a little easierly absorbed than you would get with your Naturopathics or any of your natural or bioidentical thyroid hormones. But everybody loves Wisconsin cheddar for its flavor, for the fact that it has less ingredients, and your body kind of absorbs it a little bit more naturally. I understand 80% of the world is lactose intolerant, but you know, 3/4 of us don't care either. So the big benefit with bioidenticals is that it has both of your active T3 and your inactive T4 thyroid hormones, so therefore you can use what you need to immediately with the T3, and then your body doesn't have to work so hard to convert your inactive to active, so you get a little bit of rest and relaxation with that thyroid, because that thing works really hard. It's kind of like the heart, never really stops. So, you know, treat your thyroid nice. So what are some natural things that you can do for your thyroid? Eat a good diet, don't overtax it. And let's talk about gluten-free for thyroid, shall we? There's not a lot of studies out there in favor of gluten-free for thyroid, but in the same instance, there's a lot of studies for gluten-free for thyroid. Gluten's not the best for thyroid. There might be a lot of studies out there that say it's pretty inconclusive data, but you know what? I think clinical data and personal experience outweighs a couple research articles. And that's just my personal opinion. It's what my patients experience. And you know what? It's a lot what my friends experience too when they have thyroid issues. You might be thinking to yourself, do I have a thyroid issue? Well, I guess you could ask yourself some questions. Do you have an issue with being tired all the time? How about gaining extra weight that you find harder to get off than your friends? What about feeling like you can't remember anything? Is your hair falling out? Is your nails brittle? These might be a few of the symptoms that you might be experiencing when you have thyroid issues. I say all that to say this. If you have a thyroid problem, make sure you get it checked out. If you even think you have a thyroid problem, get it checked out. Go talk to your doctor. Thyroid panels are so cheap. Thyroid medication is so cheap. Even the bioidentical stuff, so inexpensive. And it's your health. It's an investment in how you feel about your body and your mind and your preventative medicine so that you can live as long and as healthy as you possibly can on this planet. Some long-term complications that you can have if you don't get your thyroid checked, please, for the love of God, get your thyroid checked. Long-term complications that you can have if you don't get your thyroid checked are infertility, so you can't have them babies, heart disease, not good for anybody, you need that heart to work, and osteoporosis, which is when you have not enough bone material in your bones and you can have brittle bones and you can have easy breaks, and it has some other long-term complications all on its own. So go get it checked out by your physician. Feel better about your life. Get that brain fog out, get that energy level back, make your hair grow strong, make your nails grow long, get your skin back to that moisture. Everybody likes to feel young. So not only do preventative medicine, but also do some anti-aging, because having an active thyroid makes you feel oh so good. So that's all I got for you this week. Make sure that you go and talk to your doctor if you have any of these problems: fatigue, weight gain, brain fog, dry skin, brittle nails, feeling cold or too hot, diarrhea, and you just feel like a general bleh. Go talk to your doctor, because it might be affecting you, and it's as simple as taking one little medication. If you like this content, make sure you give me a big old thumbs up. Make sure you subscribe so you can get notified when I upload future content, which I'm doing more and more, and I'll see you guys in the next one. Bye.